A question you may have asked yourself as we studied population health is, what's the difference between public health and population health? The Institute of Medicine in 2002 defined public health as what society does collectively to assure conditions for people to be healthy. In this chapter, we will consider what public health and the practice of public health are about. The first question the text asks is, who's in charge of public health? To answer this question, we will explore the differences between prevention and treatment and describe governmental organizations that are responsible for public health. As we consider responsibility for public health, I will also talk about public health ethics. The last topic we will consider is how public health is changing with some of the new public health initiatives that have occurred since your text was written. The Institute of Medicine defined public health in a very broad way, so it deserves additional explanation. A key concept in the definition of public health is also that public health is prevention focused. As opposed to treating disease as it is discovered, it has a focus on preventing disease. In order to prevent disease, communities need a healthy environment that provides clean water and sanitation, which is the cornerstone of disease prevention. In addition to clean water and sanitation, public health initially focused on the prevention of communicable disease, such as smallpox and tuberculosis. With vaccination and treatment for acute diseases, the current focus of public health is also on chronic diseases that are the result of unhealthy behaviors, such as smoking, lack of exercise, and eating unhealthy foods. Public health had a significant role in the design of the Affordable Care Act and supported components of the act that included the establishment of the National Prevention, Health Promotion, and Public Health Council, the Public Health Prevention Fund, and a grant program to support the delivery of evidence-based and community-based prevention and wellness services. These initiatives have largely fallen by the wayside when funding was withdrawn, but a major component of the ACA, the coverage of preventive services, remains largely intact. The World Health Organization definition for public health and defines it in terms of core public health functions: assessment, assurance, and policy development. Within these core functions are the 10 essential services that further define public health. Every day we experience public health. We may not think about it when we drink safe water or when you eat at a restaurant that has been inspected by the local health department. Many people think of public health when they get their flu shot or when they get their vaccinations at a local health department. These examples of public health also fit within the essential services on the previous slide. Some of the policy examples include water fluoridation, food safety regulations, and mandatory school vaccinations. An example of the enforcement essential service is the inspection of a restaurant to enforce food safety regulations. Hand washing is one of the most important public health interventions and the easiest to implement. Hand washing is an example of the essential service to inform, educate, and empower. A community exercise program is an example of mobilizing communities to be healthy. This chart provides a good overview of the public health system. Perhaps this is why it is difficult sometimes to envision what public health is, that it is more than the state health department. The public health system includes all public, private, and voluntary entities that contribute to public health activities within a given area. As you can see, entities within a public health system can include hospitals, physicians, managed care organizations, environmental agencies, social service organizations, educational systems, community-based organizations, religious institutions, tribal organizations, and many others. All of these organizations play a role in working to improve the public's health. The text describes 4 factors that contribute to the complexity of the public health system. The previous chart gives you a pretty good picture of some of the problems conceptualizing what public health is. The public health system, like the healthcare system, is not centralized. Most public health functions are under the authority of the state. States vary widely in how their public health system is organized. For example, in Oklahoma, we have a combination. The state office oversees all county health departments with the exception of Oklahoma City County Health Department and Tulsa City County Health Department, which are independent. In Kansas, all county health departments are independent of the state health department, and the state health department has much less influence on the counties. The federal government influences public health primarily through funding. It funds the Centers for Disease Control and Prevention, that in turn provides grants to states. The second factor that adds to the complexity of the system has been the disease-centered approach. Many public health programs are focused on a specific disease or health problem. The different departments in the state health department are an example of that. The infectious disease division includes sexually transmitted diseases, HIV, tuberculosis, and other specific diseases like West Nile virus and Zika virus. The chronic disease division has a cancer registry. The injury division focuses on intentional injury such as suicide and unintentional injury like car accidents. Issue-specific non-governmental organizations also play a very important role in the public health system, but again, they tend to be issue-specific, like the American Heart Association, the Alzheimer's Association, the March of Dimes, and the American Red Cross. The fourth factor is probably the most critical. Public health has struggled to focus on specific public health goals and how to achieve them. Projects like Healthy People 2020 have a large number of goals and benchmarks, but no real plan as how to achieve these goals. In 2017, a challenge was given to local public health directors, Public Health 3.0, a call to action for public health to meet the challenges of the 21st century. The idea of Public Health 3.0 was for governmental public health to serve as the chief health strategist, partnering across multiple sectors and leveraging data and resources to address social, environmental, and economic conditions that affect health and health equity. The outcome of this initiative is yet to be seen. The key focus of public health is the population compared to the focus of the medical system on the individual. Public health is data-driven, using epidemiology to identify incidence and prevalence of health problems, what populations they affect, and where they occur. As in politics, the bottom line is that public health is local. That is why the chief health strategist is the local health director. In order to tackle public health issues, communities need to mobilize to address their health problems. We all have an interest in public health. The foundations of public health are found in human rights and social justice. Public health is, by definition, a function of government. It cannot be accomplished through private and nonprofit organizations alone. Opponents of public health are often opponents of government intervention in the lives of individuals. Public health has an ethics code that is similar to medical ethics in the principles of justice, non-malfeasance, and autonomy. There is a balance of these principles in public health to consider the loss of individual liberty, say in a mandatory vaccination program or a mandatory quarantine, weighing the good of the community with the loss of liberty of the individual. These powers can potentially be abused. The other issue is the concern that government does not need to be involved in public health. This issue can be answered simply that in order to have population data that can be used to improve health, government needs to be involved. The market system simply does not work with disease. 3 key components you should know about are the prevention levels. This chart provides a basic description of these levels. The levels of primary prevention avoids disease altogether. If you receive a vaccination for measles, you avoid the disease. Secondary prevention is identification of people with risk factors or preclinical disease and providing treatment. An example is blood cholesterol. Elevated cholesterol is a precursor to heart disease, so individuals with elevated cholesterol are treated with medication to lower their cholesterol. Tertiary prevention involves identifying and treating individuals with disease to maximize health and prevent complications. An example is a person who has a heart attack who receives rehabilitation treatment and prevention through diet and exercise to prevent further damage. In developing prevention interventions, there are 2 strategies. Universal prevention is for everyone, such as seatbelts. Targeted intervention is based on populations at risk, like focusing on diabetes prevention in the Hispanic community. Public health uses a problem-solving process to address public health problems. Once a problem is identified, it is critical to identify what the cause of that problem is. Public health interventions are targeted to address that problem. There are many evidence-based interventions to address public health problems, but they have to be tailored to the community where that problem exists and then evaluated as to their effectiveness. This has been a shortcoming of public health in the past. Interventions were implemented, but not necessarily evaluated for their effectiveness. Where does public health get its authority? States have statutes that define the roles of public health in that state. In Oklahoma is Title 63. This statute defines the role of the state health department, the Board of Health, and local health departments. States work together with the federal government through federal agencies such as the CDC and the Department of Health and Human Services, who provide funding for public health programs in states. The authority of the local health department is dependent on the state statute and also how much authority the State Department of Health delegates to local health departments. This often is in the form of funding for specific programs. I mentioned the role that states have in public health, the core public health functions, and the 10 essential services. A relatively new role for public health is public health emergencies. This role really became enhanced with the bombing of the Twin Towers in New York in 2011. The result of this emergency made it apparent that public health was a critical partner along with fire and rescue, emergency medical service, and law enforcement in public health emergencies. As a result of 9/11, public health received substantial funding from the federal government to develop the infrastructure to address public health emergencies such as bioterrorism, influenza pandemics, and also natural disasters such as hurricanes and tornadoes. The surge in funding for public health also paid for training in emergency response and supported programs in performance measurement and accreditation. Public health is in a continuous process of quality improvement and change. As funds for government programs shrink, there are new incentives to build partnerships and to be more strategic in funding programs that have the most impact on health. The incentives for public health in the Affordable Care Act have, for the most part, lost funding. One provision of the ACA that has forged partnerships between hospitals and public health has been the requirement for nonprofit hospitals to conduct a community assessment once every 4 years. This assessment must include community stakeholders and specifically include the local health department. Public health institutes are non-governmental organizations that usually are nonprofit and can accept private and public funds to support public health initiatives. Oklahoma has a public health institute, the Public Health Institute of Oklahoma, that has partnered with OU Family Medicine to create non-governmental community health improvement organizations to improve health in local counties and their communities. The text makes a good point that many people do not understand what public health is and what public health needs to develop a constituency that values and supports public health. As it is often stated, we don't know what public health does until it is absent. We do not realize that public health provides vaccinations until there's an outbreak of a vaccine-preventable disease. We do not realize public health inspects water treatment plants until a community has unsafe drinking water and cannot drink water out of the tap. The text makes the argument that public health has to work with the public to gain their trust. To do this, public health must be visible in the community. In Oklahoma, we have a history of problems with the management of the state health department, most recently a budget crisis and mismanagement of funds. It is challenging to instill trust in public health when the headlines describe a corrupt system. Oklahoma City County Health Department and Tulsa Health Department, as independent county health departments, have provided a good example of how local health departments can collaborate with the community to develop public health initiatives. They have initiated community health improvement plans to prioritize health problems and implement community-focused interventions. A recent Oklahoma City County grant is a partnership with law enforcement and the jail to prevent services for prisoners. This is a good example of what local health departments can do as they partner with the community.